A new, potentially life-saving treatment for leukemia. And one of the most positive outcomes yet is this little girl. Her name is Emily Whitehead. She's just 7 years old. She has been in remission for 7 months now. Trace Gallagher has her story from Los Angeles. Trace.
It's amazing, Allie. When Emily was 5 years old, her mom was bathing her and found that she had bruises all over her body, and she was later diagnosed with leukemia. Now, the good news for Emily was, at the time, it was the most common form of childhood leukemia, but the bad news, and the cure rate was 85%. The bad news was she was among the 15% who were resistant to chemotherapy, and without some other treatment, Emily would surely die. Listen.
We had come with a team of doctors in the PICU every morning and did rounds with us, and we were always first. And they would come to us and kind of show us a line on the floor and say, if that's the line of survival, Emily has almost stepped past it.
So when she got to Children's Hospital in Philadelphia, the cutting-edge treatment was to take Emily's blood, extract the T cells, then re-engineer them, put them back into her body. In essence, the re-engineering was the key because they actually were using a deadly disease to fight a deadly disease. Listen.
What my colleagues have actually done is to take the parts of the HIV virus that are good at getting into cells, get rid of the parts that make the cells sick and that kill the cells, and replace that with molecules that can then target the cells to fight leukemia.
Yeah, but the cells overreacted in Emily's body and she was critically ill. Her parents were told to prepare for the worst, but then using some anti-arthritis medication, doctors were able to stabilize her, and now you look at her. 7 months later, she has zero signs of leukemia. She still needs to go through 2 years before they will say that she is cured, but what an amazing story of recovery, Allie. The parents told us, look, they were really being told the night that she was so sick, you have very little time, get the family in here.
And now look at how beautiful she looks. Trace, thanks for all that background.
Okay.
So for more on this potentially life-saving cancer treatment, let's bring in Dr. Richard Furshine. He's the author and director of the Furshine Center for Comprehensive Medicine. Dr. Furshine, great to have you here.
Thank you.
Explain to us why this could be such a game changer.
Well, right now, for leukemia alone, acute cases, 6,000 children are diagnosed every year, 44,000 adults diagnosed with leukemia. What these doctors have been able to do is to actually insert a specific gene which will allow the body to target in T cells, allow the body to target B cells, which actually are the dysfunctional cells in a leukemic's body, actually allow the body to intercept those cells and destroy them. So this has huge implications, not just for leukemia, but for cancer treatments as we know it.
And we just saw the story, obviously, of Emily Whitehead. There we're seeing, I believe, her on the other side of the screen at her worst. And, of course, the treatment almost killed her. The leukemia almost killed her, and then the treatment can be so severe. Doctors refer to it as shake and bake, the reaction, because it can cause tremors and such high fevers. But she survived it.
Yes.
But for some people, they're not that lucky.
Well, in this case, what happened was part of the treatment, by inserting T cells, it stimulates the immune system and it produces a lot of flu-like symptoms. What doctors didn't know at the time was that it was going to be this dramatic. What they did, straight out of an episode of House, that night they figured out that there was a specific drug which targets a specific compound, a cytokine, which is released that causes these flu-like symptoms. They were able to give her this drug, and they were able to alleviate the symptoms. So we have not only a treatment, there is a side effect, the doctors have figured out how to deal with it, and there are also 10 other patients who have been in this study so far, basically 4 in complete remission. The 2 children are doing very well, and there's, obviously the others who are in partial remission, so that's exciting.
But obviously 10 people is not a big study. When could this have more widespread usage?
Well, doctors are going to start the studies. They're going to amplify this. There are a number of different researchers at different hospitals that are using these gene splicing techniques, which are really, again, another, I hate to use all these metaphors of Star Wars, they're going in, they're inserting these genes which can actually specifically target cells. So why people are so excited, even though this is a limited number of cases, is this is really the first time we're seeing these treatments work in patients that would have died otherwise. She had no other treatment options. Chemotherapy wasn't working. There was nothing else that can be done. And the doctors gave her this treatment, and she's doing fine.
Modern medical science, it's incredible. Dr. Richard Furshine, thanks so much for explaining it.
Thank you.
All right.